Hi, good afternoon, everyone. It is 4 o'clock on November 16th, and I'm Rebecca Dunckel-King, Superintendent of Belleville Academy. Thank you so much for being here with me tonight to get some updates from the district. Today, I want to talk to you about what to expect in the coming days and weeks, and I'll just start off first with some county-specific statistics. Lewis County has been averaging about 7 positive COVID-19 cases a day. There has been a rise in positive cases in the nursing home at the hospital. There have been cases that have stemmed from hunting camp and Halloween parties and gatherings like that, a lot of family gatherings. Our health system is starting to feel the stress. The number of beds used for acute care are being filled, and if something doesn't change soon, they will not be able to accommodate additional COVID positive patients. If the number of cases continue to rise at this rate, the health systems will be overwhelmed in the next week or two. So at LACS right now, we have only 2 employees under quarantine and 1 employee who tested positive today. Luckily, that individual has not been in attendance since last Tuesday, so there are no contacts at school. However, like the health system, if we see this trend continue, our systems will also be stressed, and we will be overwhelmed with trying to find substitutes for those who are home. The county school districts are now faced with the difficult decision to keep schools open and wait for the tipping point, or to close our doors for an extended period in a proactive attempt to flatten the curve. We understand that closing our doors will impact families, and that those same families depend on the consistency and predictability our school offers. With that said, without any or very little enforcement in our community for COVID-19 regulations, the ones who end up feeling the consequences are our students, as we know. As we look at the daily data and weigh our options for the coming weeks, I can describe to you 2 scenarios that we will decide on by Wednesday, November 18th. The first is a wait and see. What we'll do is evaluate the county data and district data to determine the best instructional model for our LACS community. The pros of this are that if the county data improves, we can continue as we have been. The cons are this puts stress and anxiety on all stakeholders. Waiting for the unknown can sometimes be more harmful than being able to plan for extended remote learning. The second scenario is remote learning from November 30th through January 11th, 2021. The pros of that is if you know now, you can plan and make arrangements for your family. There's a lot of missed days during that time because of Christmas break and New Year's. So that would help the number of days that we would miss for in-person. The cons of that is that long periods at home, as we all know, can be stressful on a family. So as we also know, we may not be offered the luxury of making a decision. We may simply have to close our doors depending on positive cases and contact tracing. What I can assure you is that the district's goal, at the very minimum, is to stay in attendance up through the normally scheduled Thanksgiving break. I'm going to repeat now a couple of things I said during my November 5th video. As we head into Thanksgiving, 10 days from today, it's important that we understand updated travel guidelines from the governor and the Department of Health. So Governor Cuomo changed the quarantine requirements for people traveling into or returning to New York State. Any student or staff who travels to a state other than those contiguous to New York may test out of mandatory 14-day quarantine to return to in-person work or school. Travel to and from states contiguous to New York, Vermont, Massachusetts, Connecticut, New Jersey, and Pennsylvania are exempt from the quarantine requirements. Any student or staff member who was in another state for more than 24 hours must obtain a test within 3 days of departure from that state. They must, upon arrival in New York, quarantine for 3 days, and on the 4th day, they may obtain another COVID test. And if both tests come back negative, you can exit quarantine early upon the receipt of the second negative diagnostic test. Local health departments will validate tests if necessary, and if a test comes back positive, they'll issue isolation orders and initiate the contact tracing process. The local health department must make contact with the state the traveler came from to ensure contact tracing proceeds there as well. So it's important to note that the governor is encouraging New York residents to refrain from non-essential travel in New York to limit the spread of COVID-19. Other information that you're likely hearing about is the microcluster strategy that the state is using. These zones, red, orange, and yellow, are defined as the following. Red is a high infection zone. That's when we test 5% or higher. Orange is a warning zone, means the region has an infection rate of 4% or higher. And then yellow is a precautionary zone, and that means that the infection rate is 3% or higher. So schools in a red or orange zone must close until the infection rate drops below 4%. Schools in a yellow zone can remain open as long as we test 20% of our students and staff in the first week. And if those results come back lower than when we were put into the yellow zone, then we can remain open. So bottom line is we don't want to be a yellow zone. We don't want to be an orange zone or a red zone. We want to avoid that opportunity or that designation. What is happening is that our infection rate is high enough to place us in any one of those zones right now. What has been wonderful is that our public health has done such a great job on contact tracing, is that they've been able to trace all of the, well, most of the positive infections to a cause. And as long as we can do that, we're in pretty good shape to stay open. Unfortunately, because this spread is getting larger and larger and larger, the contacts are becoming more and more difficult to trace back to a root cause. And when that happens, we will certainly be identified in one of these zones. So what can you do to help? Obviously, wear a mask and wear it the right way. Stay socially distanced. This is difficult during the holidays, but it is important to not let your guard down during this time. Many of the positive cases come from family gatherings. Please wash your hands. Don't attend, let your children attend, or host any gathering of more than 10 people in a private home. As always, our priority is health, safety, and well-being of our students. If we work together as a community to stop the spread, our students will be able to continue to realize the opportunities that LACS has to offer them. Now, I'm sure you have questions. I'll give you an opportunity if you'd like to type something in the chat box, and I'm happy to answer anything that I possibly can. If you're uncomfortable doing that, you can certainly email me at rdunckel-king@louisvilleacademy.org, or you can simply do info@louisvilleacademy.org. Again, going back by Wednesday afternoon, I'll notify the community of whether or not we're going to stay in this wait and see approach and sort of kick the can down the road to see how long we can manage to stay open. Or I will notify you Wednesday that we will be going to full remote learning between November 30th and possibly January 11th. So we're not closing down yet. You know, if, like I said before, if the data continues to move in the direction that it's been moving in, we will have no choice but to act in that, to be precautionary. So there's a difference between being proactive and closing before we reach a tipping point, and being reactive and closing because we can't manage to stay open because our systems are stressed. And when it gets to that point, it's incredibly difficult to open back up, and it adds stress onto every system in the county. So we don't want to get to that point. If we do decide to close our doors and move to remote learning, we will make sure we push out the same resources for, how to get school-aged childcare, how to get food from the district, technology needs met, social emotional well-being needs met, and of course, instructional needs met. But I do want you to know, and I think you all understand. Oh, that's a good question. So someone's asking about the cost for school-aged childcare. So the CARES Act, and I will push this out if we do decide to close our doors. The CARES Act has there's an opportunity there for people to apply for relief for childcare, and it goes from, I think they renewed it at the end of October, and it goes through January 10th. So I'll make sure everybody has that resource so that if you need, and that doesn't just cover, the childcare, like hand in hand might offer school-age childcare here. It really refers to or addresses any childcare that you use, any private childcare or public. So that's something that we can rely on. Okay. Oh, okay. So says, I believe it is increasingly apparent that the adults in our community can't be trusted to follow proper protocol to protect others. Isn't closing proactively the best solution? And that is exactly the question that we're wrestling with right now. To be totally transparent and honest with you, yes, probably closing proactively is the best solution. The thing that we're feeling, the angst that we're feeling, are our most vulnerable children and the situation that they might be facing when they leave these doors. So closing a school it takes more time than just, a day or two to make sure that we have all of our bases covered. But yes, will the county schools be making the decision jointly? That's the hope. That is what we're all trying to, so we are all talking all the time. We are on the same page. We all have a joint responsibility to address this spike in COVID-19 cases. At the same time, we all have very specific and unique populations that we have to address. So one of the reasons this decision is sort of being, like I said, we're kicking the can down the road, is to make sure that we're all communicating very well together and finding out if we can do this in unison, because that would be the goal. How will services be delivered for children with IEPs if we go remote? That's a very good question. So remotely, the services would be delivered remotely through the computer. If we get to a point where, so at first everybody goes home, this is the protocol we would follow. Everybody would go home, and then as numbers start to improve, we would potentially start bringing back small groups of children. So we wouldn't, again, stress any systems or the county in any way. And so we would bring kids back, and obviously our most, like I said, vulnerable, both socially, emotionally, and educationally. Those groups would be brought back first if we were at a point where we could do that. Right, so so this question, I don't know if you guys can see the questions on here or not, but the question is, I say the 11th, South Louis is considering the 19th. So none of these dates are set in stone, and that's what I mean by the unique needs of a district. So, let's say all of this happens, and I'm just saying there hasn't been a decision yet. But let's say this happens and Louisville goes until the Tuesday before Thanksgiving, but I don't want to throw out a district because I don't want people to think that this is really a thought, but another district decides to go 3 days before that. There are little nuances that might not be exactly the same across the county, again, depending on the unique needs of the district. So school spread is not the issue right now. What is the issue is that, like we said, adults are not following the protocol. What is starting to happen is that they are bringing their children to these places. Children are starting to go to parties and go to gatherings, or go with their parents to large gatherings. And the idea is that they will come to school, or if they work in a school, they will come and they might not be sick, but they will transmit it to someone else. And so again, as the community spread gets larger and larger, it's harder to keep it out of our buildings. And it just takes, one person to come in and pass it along to everybody. So if they close until mid-January, you don't anticipate opening back to the same schedule or capacity at that time. So our goal would be January 11th to be open at that point, full capacity, the capacity that we are at right now. What I was referring to before in those small groups of students, if before that, during this closure, we would reach out individually to groups of families to say, the numbers in the county are very low, but not low enough to bring everybody back, and we would base it on the safety precautions that we could put into place at school. So there will be a letter on, so I'm sorry, I don't know if you can see the questions. It says, if the school closes, will there be another YouTube notice? There will be all sorts of notices to make sure that people know. My goal is to give you as much notice as possible. So I don't want to, wait the entire weekend and come to school on Monday and find out we're closing and then only give you 2 days. So my goal is to make a decision on Wednesday afternoon. A letter will go out, and we'll reach out in as many ways as possible. Robocall, probably not another YouTube live, because it's going to be one communication. Oh, you can, thanks, Scott. I didn't know if you could see them. One other thing to mention that is, if we do close, you can rely on regular YouTube lives at that point. So I can, update you on our statistics and what we're thinking, what we're planning, how we're moving forward. The letter will be on paper with students, but this is the thing you have to remember. Wednesday, only elementary students are here, K through 4. So it'll be in paper for those students, but it'll also be online on Facebook. And then on Thursday, when other students come in, we'll make sure those students have the letter. So please check all your media outlets. I'm sure if I write a letter and post it, it'll be on Linking Lewis County in like 20 minutes, which is good. All right. Okay, so until we see each other again, stay safe, stay healthy, and please feel free at any time to reach out. I'm happy to get feedback. I'm happy to consider alternatives or just to even hear you out. I'm here, I live in the same community as you do. My kids go to school here, so I certainly understand the weight of this decision. All right, thank you very much for your time, and we'll see you next time.